Welcome to this special edition of Conversations on Cannabis, brought to you by the Medical Marijuana Education and Research Initiative at Florida A&M University. I'm Heidi Otway, and on this program, we're talking about cannabis and mental health. Our guest is Dr. Alicia Rowley, Associate Professor of Counselor Education at Florida A&M University and a licensed mental health clinician. Dr. Rowley, thank you for being our guest on Conversations on Cannabis.
Thank you so much for having me.
So with the November election, the pandemic, and the upcoming holidays, it's safe to say that many Floridians are going through a tough time mentally. Can you share some of the most common types of mental health disorders that people may experience?
Absolutely. I can tell you that this has been an unprecedented time in our society, in our time, and it has been incredibly difficult for people to cope with the changes. I can say that when the pandemic happened, because it's never happened in our lifetime, I think myself, like everyone else, was probably thinking that this would be temporary, but the changes that we have had to make long term have really taken a toll on my mental health and the mental health of my clients. I have seen an increase in depression, an increase in anxiety and adjustment disorders as a result of some of the changes that have happened with COVID-19, with the issues of racial injustice in our society, and with our political climate.
So what are some of the warning signs that someone may be experiencing a mental health disorder? What are the things that people should be looking out for that says to them, you know what, something's not right here?
That's a great question. Some of the things I have seen is an uptick in withdrawal, for example. So with the pandemic, naturally, some of the things that we have had to do have been, unfortunately, to distance ourselves from others. And social distancing has become social isolation, which has really had an issue or a great impact, rather, on the mental health of many people in our country. I think one of the things when you look at anxiety and depression, some of the warning signs naturally are changes in habits. Things that are normally enjoyable that are no longer enjoyable, difficulty in finding joy, difficulty in managing the feelings of being overwhelmed or feeling like they cannot identify one emotion because everything feels like it's kind of lumping together. I hear quite a bit of that now in practice, not only from my clients, but from my students. Students, for example, have just really had an increased level of stress with abruptly needing to go from a brick and mortar learning situation and environment to finding out how to navigate online courses. And that was very difficult for them in terms of finding resources, finding a great space for conducting courses, and finding a way to navigate this new learning environment. So many of them were just kind of stuck in working in silos, just like those who were, forced to move from going to work every day, getting dressed, going to work. There is something to be said about routine and trying to be self-disciplined and create your own routine can be difficult. So I'm finding that I see quite a few people that are struggling with finding a new normal, finding a routine. And so some of the signs to look out for also are an increase in anxiety. Anxiety can be physical, can be psychological, and can feel like you may have some type of medical issue, for example. So heart palpitations, sweaty palms, butterflies in the stomach, or digestive issues. Because as you know, even as I state some of those signs and signals, they sound a lot like some of the things that we've been told to look out for COVID-19 related symptoms, for example. So I found that it's very difficult for individuals to distinguish between there being a medical problem and the fear of COVID-19 and, an actual mental health disorder. So those are some of the things to tune into. I think the first thing I tell any client is the 1, 2, 3, what is really bothering me method.
Okay,
So
let's talk about that.
yeah. So each time, I think what happens with our thoughts is that thoughts are like seeds that are planted. And as we go along the day, we don't even realize how those seeds are watered and they grow so quickly. So we don't attack those negative thoughts. I call it stinking thinking. And what happens is they grow throughout the day and they
That's
can
good.
cause marked disturbances in our behavior and mental health. So tuning into ourselves and knowing when something doesn't feel right, when we're feeling anxious but can't put our hands on it, or are we sleeping more than normal, or we're eating more than normal or less than normal. Those are some of the things that we need to tune into to our bodies and to know when something doesn't feel right.
Yeah, those are some really good tips. Thank you for sharing those. In your practice, what are you seeing and hearing about medical marijuana as a mental health treatment?
That's a very interesting question. Well, as a clinician, we are driven by evidence based treatment practices.
Yeah.
Medical marijuana is a newer emerging topic in the field of medicine. So there are not many studies that are grounded in evidence based outcomes, but there are many clinicians who have had experience with working with clients who have reported the use of marijuana for the decrease of anxiety or those who are dealing with chronic pain and depression. So I think that one of the things that is most interesting about medical marijuana is visiting somewhere, a dispense. I can think of the name, a
Yeah, the
dispensary.
dispensaries. Yeah, they're all over Florida now. Yeah.
Yeah, they are. They are. I've actually visited a dispensary before, and one of the things I think I was most impressed with that we as mental health providers and especially medical providers can take away from is the amount of education given about the impact of the product that is being used or considered for use.
Right.
If you notice how you go to the doctor and you have a problem and the doctor will prescribe medication, you rarely talk about the side effects of those medications. So while there is not much evidence about the negative outcome of using medical marijuana, we do know that, for example, THC is a chemical in medical marijuana that can be addictive,
Yeah.
but so can other psychopharmacological drugs that are used for mental health diagnosis, like anxiety and depression.
Okay.
So something that I think is really important about considering the use of medical marijuana is education, psychoeducation, as we call it in mental health. If we could take the time to explain the outcomes of medication or treatment options in the same way that you get when you go to a dispensary, I think that we can learn a lot more about the impact of medical marijuana and behavioral health.
Yeah. So let's talk a little bit more about these different treatments. Like you said, we're seeing, more people using medical marijuana as a treatment because PTSD and anxiety are two qualifying conditions for someone
Mhm,
to legally get a medical marijuana card in
mhm,
Florida. Are
mhm.
you seeing more of your patients actually obtaining the card?
Well, honestly, I'll tell you what, many of my clients, it takes a little while to build a rapport to even have a conversation about marijuana because
Yeah,
of the negative connotation
the
surrounding
stigmas.
marijuana.
Yeah, yeah.
Absolutely. Um, my practice is primarily with minority individuals. And when you're working with multicultural individuals, it's important, especially as I stated before, about the racial climate. Historically, African Americans have had a very negative history with the judicial system and marijuana, which, former President Obama made strides to change. So you can imagine how difficult it is to have a discussion about the use of marijuana at all. So I find that many of my clients are just having a problem with disclosing the use of marijuana or the desire to want to obtain a medical marijuana card. So it takes a while to get to treatment options or to have a discussion about treatment options surrounding obtaining a medical marijuana card. And there is not enough information out there about how to obtain one. So I think that is what has inhibited the conversation in my practice.
Yeah. So for everyone listening, we want to encourage you to go to the Florida Department of Health's Office of Medical Marijuana Use, OMMU website, to learn how to obtain a legal medical marijuana card in the state of Florida. They have a ton of information and resources that would point you in the right direction on how to obtain it legally, as well as the qualifying conditions that do include some mental health disorders. And just for information in general, we also encourage you to go to the Florida A&M University's MMERI website, which is the Medical Marijuana Education and Research Initiative that's bringing you today's program. Be sure to check out their website as well for additional information. Dr. Rowley, thank you so much for sharing this insight about mental health disorders that people may be experiencing during these, unprecedented times, and then also sharing information about the different actions that people can take if they're not yet ready to get a medical marijuana card here in the state of Florida. Is there anything else that you would like to share with our listeners and viewers?
Absolutely. I want to let you know that we are all experiencing things that don't feel good right now emotionally. This is a very, very hard time in our society, and I think that we have to normalize our feelings, which help to decrease the stigma of seeking help and possible treatment options such as medical marijuana or some other prescribed medication. But I want to emphasize that there is no magic pill for the treatment of mental health issues. Even if you utilize medical marijuana as a treatment option or you choose another prescribed medication, it is so important for you to tune into your body, know when something is wrong, and to seek professional help. That professional help will assist in collaborating with your medical doctor to ensure that you don't have a medical issue or that this is not attributed to a medical issue before deciding on a treatment option. But it's very, very important that whatever treatment option you decide is in conjunction with behavioral health counseling or mental health counseling. So I cannot emphasize that enough. Reducing the stigma by normalizing your feelings, seeking professional help, and making an informed decision about care.
Yeah. Are there some resources that folks could go and kind of, we're all on our tablets now because we're working from home and everything. Are there some resources that you can share that can help people, identify some support or help or education and information about mental health?
Absolutely. Well, the first place I always love to go, I think it's the go-to because if you Google any clinical issue, it's probably likely going to take you to the Mayo Clinic website. So I think the Mayo Clinic is a great one-stop shop to get some signs and symptoms of different mental health issues. Also, the largest counseling association is the American Counseling Association, that's ACA, and their website is counseling.org. It is a great resource to find out a little bit more about signs and symptoms of mental health disorders.
Okay, great. Well, thank you so much for being our guest today. It was wonderful talking to you, and I know our viewers and listeners got some great information to help them during this time. Thank you.
Thank you very much.